This video is covering advanced instrumentation techniques. First, it must be clear that traditional techniques for periodontal debridement, such as ultrasonic scaling and hand instrumentation, should be utilized initially. When root morphology and disease conditions make access to deposits impossible with traditional instrumentation techniques, advanced instrumentation techniques can be utilized. Advanced instrumentation techniques will be the focus of this video. To begin, let's review a few of the newer curettes, the 1516 and the 1718. Ms. Johnson will demonstrate the Gracie 1516 on the mesial surface of posterior teeth and the 1718 on the distal surface of posterior teeth. With the 1516, you begin at the distal buccal line angle. Ms. Johnson is working on tooth number 6. She's using the toe
18
third to walk around the tooth surface. When she discovers a deposit, she opens the blade and applies lateral pressure and activates the instrument with a nice short stroke. Then she begins again at the distal buccal line angle of tooth number 19. And then walks the instrument with an exploratory stroke until finding a deposit, where she opens the blade, uses the toe 1/3 to remove the deposit. As she gets to the mesial surface, you'll notice that the terminal shank is parallel to the long axis of the tooth. After completion of the mesial surfaces, the 1718 can be used for the distal surface. With the extra bend in the shank, access is much easier on the distal surface with the 1718. You begin at the distal buccal line angle, move the instrument distally with an exploratory stroke. When a deposit is encountered, then you open the blade, tighten your grasp, and activate the stroke. Okay. The 1718 is being used on the distal surface. The extra bend in the terminal shank allows for greater access on the distal surface. The instrument's inserted at a 0-degree angle. An exploratory stroke is used to find the deposit. The blade is opened, the grasp is tightened, and the instrument is activated. The next advanced instrument is the O'Hara debridement curette. It is used to smooth root surfaces and remove small residual deposits after ultrasonic scaling. The tips look like a spoon excavator and are described as disc-shaped. The blade curves into the tooth for adaptation into furcations, developmental grooves, and line angles. The entire rim of the blade serves as a cutting edge. The blade design enables a push or a pull stroke in all directions. The buccal lingual debridement curette SOH12 has a long terminal shank that it can extend 15 millimeters in length and allows access into deep, narrow periodontal pockets. That is the instrument Ms. Johnson is using currently. It also allows the instrument to be used with an exploratory stroke to evaluate the root surface. The SOH34 is used for mesial and distal surfaces. Okay. The proximal debridement curette is the SOH34. The anterior debridement curette is the SOH56. It has an 8 mm shank and is angled to access all tooth surfaces. This is the last instrument in the 4 series of debridement curettes. It is the SOH78. It has a 15 mm shank, allowing access into deep periodontal pockets. A periodontal file has multiple cutting edges. It is like a series of hoe scalers. Each blade is at a 90 to 105 degree angle to the shank. The shank comes in various angles. Curved shanks are designed for posterior and straight shanks are for anterior. The purpose of a file is for calculus removal through crushing or fragmentation, and definitive scaling is followed with curettes. Subgingival use of the file must be away from the junctional epithelium. It is used in easily accessible areas. It is used with a vertical pull stroke. The entire cutting edge is placed flat against the area to be treated. The shank is parallel to the long axis. With a very difficult deposit, oftentimes a Diamond-Tech file would be the instrument of choice. It is a file with 360-degree diamond coating. It has a thin tip and a unique bend. You activate it with both a push and a pull motion. The benefits of this is that you can have some scaling efficiency and superior access to very difficult to reach small, narrow pockets. The Diamond-Tech file is a paired file that has the neighbor probe style to it. Therefore, it has universal applications. It is excellent for accessing class 3 frications. The extended shank has a pronounced curve. The mesial end of the Diamond-Tech file is concave. The distal end of the Diamond-Tech file is convex. It works well for line angles and deep developmental grooves. Another set of advanced instruments that was designed by Barbara Long are the Vision curvettes. There is a set of 4 curvettes, a Sub-Zero, a 1-2, an 11-12, and a 13-14. This has a 50% shorter blade and provides better adaptation on narrow root surfaces and tight periodontal pockets. It has a balanced blade tip in direct alignment with the handle. The blade tip is perpendicular to the handle and the shank is closer to parallel with the handle. It is so small that the manufacturer has provided blade identification marks which visually indicates the cutting edge.
There is a plus sign on the handle.
When using these smaller blades, this feature assists the clinician in quick identification. There are also millimeter marks on the shank. There's a raised band at 5 millimeters and there is a raised band at 10 millimeters. This helps the clinician visually assess the pocket depth during instrumentation to compare with periodontal charting and tactile sensations. The Sub-Zero, which has a long shank, is excellent for facial and lingual line angles on anteriors and premolars. That is the instrument being used at the present time. Notice the 5mm line mark. Ms. Johnson is using the instrument to 5mm. She can visually see that line and then know how deep subgingially she's going. Now she finds a pocket that is 10mm, or she knows that is 10mm from her periodontal probe readings, and therefore can use the instrument to remove the deposit all the way to 10mm by looking at the line on the
curvette.
This is a Vision Curvette 1314, it being used on the distal. It also has the 5mm markings for subgingival placement at 5mm, and the 10mm marking for debridement 10mm subgingival. Furcation curettes are designed for scaling root concavities and furcations. They are available in buccal and lingual or mesial and distal designs. The blades come in two sizes, 0.9mm or 1.3mm. This cleans the area between the roots. Furcation curettes are very helpful for those class 1, 2, or 3 furcations. Ms. Johnson is using a mesial distal furcation curette. They come in two sizes. One is 0.9mm, the other is 1.3mm. That describes the width of the blade. Another advanced technique is to use a reinforced hand rest. Here Ms. Johnson is sitting at 8 o'clock working on the lingual aspect of tooth 12 through 16 with an 11-12. With her non-dominant hand applied to the shank of the instrument, she is providing stability to the instrument as well as added pressure. The pressure is pointed posteriorly with an 11-12 instrument. The extraoral palm up reinforced with a 13-14, the pressure from the non-dominant hand is pushed anteriorly to provide stability to the instrument and added lateral pressure. One of our best kept secrets is that a 13-14 curette can be used in the anterior. If you notice, when you close the blade, you can insert it without causing tissue trauma. Open the blade so that the terminal shank is parallel to the long axis of the tooth. With your surfaces away from you, you must sit at 11 o'clock in order to adapt the 13-14 correctly. For the surfaces towards you, it's important to sit at an 8 o'clock position. Johnson is now sitting at 8 o'clock, and you can see the adaptation of a closed blade being inserted into the sulcus, opening so that the terminal shank is parallel to the long axis, the grasp is tightened, and the instrument is activated. This works well with patients that have recession, oftentimes you have difficulty finding a stable fulcrum in some patients' mouths. One technique to use is to use the finger or thumb of your non-dominant hand to fulcrum. Ms. Johnson is using her thumb to both retract the lower lip and to fulcrum. Ms. Johnson is using the Sub-Zero curvette and fulcruming on her thumb. Now she has a very stable fulcrum. In another area of the mouth, Ms. Johnson is demonstrating the finger of her non-dominant hand being used to fulcrum, as a stable fulcrum. Ms. Johnson is using her non-dominant hand, the index finger, to retract the lip and the cheek. The thumb of the non-dominant hand is supplying reinforcement and added lateral pressure to the instrument. This is also an advanced instrumentation technique. An advanced instrumentation technique for the very narrow facial surfaces of the root is to drop the handle of the instrument into the crook of the hand and use a very short, controlled stroke with the toe up horizontally, and the blade is moving horizontally. Ms. Johnson's elbow is tucked into her waist to provide added stability. Nice wrist motion, removing that deposit that's often difficult to remove on the very narrow root surface. This advanced technique, Ms. Johnson is using her thumb to stabilize the thumb of her instrument hand and also provide additional lateral support, lateral pressure and support. Another set of curettes is called the Langer curettes. They were designed by Dr. Burton Langer, who's a periodontist. They combine the best features of the Gracie shank with a universal curette blade. This allows you to scale the mesial and distal surfaces with the same instrument. The Langers have a slightly shorter and thicker terminal shank, making them less flexible. The shank is not parallel to the long axis of the tooth when a good working blade angulation is achieved. There is a set of 4 Langer curettes that are used for the entire dentition. A Langer 1-2 for the mandibular posterior, a Langer 3-4 for the maxillary posterior, the Langer 5-6 for the anterior, the Langer 7-8 for the posterior. The Langer 1-2 has a similar shank to a Gracie 11-12. It is used mesial and distal of mandibular teeth. Ms. Johnson is using a Langer 1-2 for the mandibular posterior teeth. This instrument can be, the same instrument, the same end can be used both mesial and distal. When inserting this instrument, because the blade is honed at 90 degrees, closing the blade is more difficult. So on insertion, the instrument is more open. It's very important to keep a very close eye on your angulation. When the blade is open, the terminal shank is not parallel to the long axis of the tooth. So unlike your Gracie curettes, it is not a self-angulating instrument. In other words, when the blade is open, you cannot tell whether you are at 70, 80, or 90 degrees. If you're at 90 degrees, laceration is possible. Although many say that these instruments are very nice because you don't have to change instruments when doing the mesial and distal. There are some negative points to the instrument or disadvantages.